Hello, hello. This is Dr. Jeffrey Roth, your board certified plastic surgeon in Las Vegas, Nevada, coming at you yet again. New year and new season, and we're back. Who would have thunk it?
I know, 2024. That's crazy, right?
It is crazy. So absolutely right, and crazier still. And we'll talk a little about this, I guess, during the cast here is, believe it or not, we've been back in Vegas, and the practice has been open for 20 years. And and so for those of you who are kind of just tuning in, a local kid moved up to Vegas with my family back in 1977, went to high school here, Chaparral High School for us cowboy alums, and went away for forever for training, and came back and hung out the shingle about 20 years ago. So,
Right.
We were counting the rings the other day, and we're like, holy smokes, how did that happen? So,
Yeah, and people here 20 years for their practice, but of course it goes way back because how many years were you in school? Because you had residency and
yes. So that's basically forever. And it's all the good years are wasted. No. So basically, post-secondary education, meaning college and med school, and 10 years afterwards. So 18 years of formal education to finally come back and put out my shingle. And I was 36 years old, I guess, and if I'm counting that back right. And and then you get to go ahead and start.
Right. Yeah.
So,
all the preparation. And so when you guys started the business, because that's something we had talked about before. So obviously it's a practice, a medical practice, but it's also a business. So what were the challenges when you originally got going and setting up?
Oh, there was a tremendous amount of challenges in as much as you go ahead and you go to study 18 years, you're working 120 hours a week, and you're doing all that stuff that, is in the movies, and okay, sure. And then you finally come out, and you can go ahead and work for a university and be an academic guy. You can work at a private practice place, et cetera. So, so it turned out that I want to go ahead and put my shingle out and do that. And so I went to the hospital to go ahead and get privileges and all that. And they said, oh, yeah, you should go ahead and see Selma Bartlett over at Bank of Nevada. And I'm like, okay. So I go, and again, of all those years of training, I got 0 days of business.
Yeah, because they don't really tell you about that.
So at this point, at that point, I was trained to crack open a chest in a hallway and stick my thumb in somebody's heart. I can open up a brain and suck out clot. I can do all of that kind of stuff. But somebody handed me a profit and loss. I'm like, what's this? I'm like, really, doc? And so I had no idea. So I go ahead and I go to, I think I told this story before. So I go ahead and I see Miss Bartlett over at Bank of Nevada. And I walk in, and she's a very nice gal. And she says, we read a little bit about you. Okay, we know where you trained, et cetera, et cetera. She says, you have student loans, right? He says, yeah. So you're.
I have a lot of student loans.
So you're underwater. So yeah. He says, you don't have any money. Like, do you? No. It says, you need some money to start your practice. I'm like, yeah. And she says, okay. She says, how much you want? I says, I have no idea. And she says, I think you need $250. I'm like, okay.
Right.
And she says, all right, we'll go over there and sign those papers. I'm like, all right. And that was...
Yeah, it has to be a little overwhelming, right?
Oh, absolutely.
And you got to hire a staff. You got to do
no
all that
idea
stuff.
what I was doing. And it was some, but little.
Yeah.
And it was, and she was awesome. And she says, yeah, fine. And later, almost 20 years later, I went back and I said, Mrs. Barton, she had retired by then, et cetera. I said, and she put about at least half of the doctors here in Las Vegas in practice.
That's amazing.
At least half.
Yeah.
And that's why the hospital sent me. And I said, why did you take a chance on me? She says, well, you were from here. You were well trained. We can tell you're a go-getter. You're going to be fine. And she says, in my experience, the doctors, she says, we've never had a default. So in all those years, now we've had divorces, we've had partners split up, we've had nightmares and everything else like that. But as a rule, you guys, your ROI is good because you're basically responsible and it's a priority.
Well, you've already gone through all the residency. And you have a good track record.
Kind of proved that like you're not afraid of hard work and stuff.
Exactly,
like that.
Right.
And then she made some suggestions. Oh, and you might want to go ahead and talk to this person for referrals and all that kind of stuff. So, and then she and Bank of Nevada and shameless plug for those guys, have always been very helpful with the medical society, the Clark County Medical Society, the Nevada State Medical
And
Association.
you're actually president. You're a past president.
Past president of the Clark County Medical Society. As we, you stick around long enough, they give you another title, right? And so currently, I'm on the glide slope right now. As I sit here today, my current hat is secretary of the Nevada State Medical Association.
Awesome.
So
that's great.
eventually, at some point, you'll cycle into all of that. But I enjoy it. I get to see medical society stuff. I get to see other guys and gals who are in medicine. And so, again, as a plastic surgeon, especially aesthetic, you are kind of in a silo because I don't go to hospitals a lot anymore. So I don't know what's going on with the pediatric folks or the OBGYN folks.
Right, because you're really in your lane.
Right.
Much,
so it's nice to kind of see, hey, what's going on in the house of medicine, and then how can we best help our patients and protect our patients. So,
yeah, which is the number one priority. Yeah.
Absolutely.
So what's really changed? I mean, 20 years, it seems like the medical technology is always changing. Procedures are always changing.
Yeah, so much.
So a lot has changed. And then also, too, how do you keep up with all the changes?
Right. So, again, I had a professor, the late Dr. Gradinger, who once said, hey, Jeff, he says, if you get bored in plastic surgery, you're not reading enough. Because there's always something new. There's a new technique. There's a new machine. There's always a new machine. There's folks that are really pushing the envelope. And we really see this in microsurgery a lot. I am astounded with the reconstruction that's going on now. They're putting, and by microsurgery, what you do is you have a hole that you need to fill, right? What basically would really get down to it. You have a space, a gap, a hole that you need to fill. Because they took out a tumor or there was a burn or something.
Right.
You're missing.
Now you're kind of dealing with the aftermath.
You're missing a piece, right? And so the whole idea is can you shift some tissue into that space and make it functional as well as nice looking, etc. And sometimes you have to take tissue from one area of the body and put it on the other. And so that's microsurgery or free tissue transfer. You pick it up from one place and you put it on the other, right? And so back in the day, I was doing, during training and such, doing toe to thumbs. Basically, if you lost your thumb, which is basically you lost a grip on your hand. So at the Bunkie Clinic up in San Francisco, shout out to the Bunkie Clinic, we were doing, and they still are doing, they're taking the big toe off and then transplanting it and making a thumb out of it.
Oh, that's interesting.
Spectacular. And so, and I can go on.
Yeah, you got it. Your thumb is so important.
Right. So, and I can go on and on of the different tissues and the tongues or scalps or this or that. But having said that, the whole thing in 20 years is they're transferring bigger pieces of tissue on smaller and smaller vessels, and it's working. And it astounds me how far they're pushing that envelope and how successful things are going. In fact, they're getting now down into the lymphatic system, which is basically that system that controls swelling.
Right.
So, for example, we've all seen folks from the 70s who these poor women had mastectomies, 99% women had mastectomies, and back in those days, surgeons would go ahead and take out all of the lymph nodes. Now we don't have to do that, thank God, and get the same cure.
At that point, it was very traumatic.
It
still is.
Big shark bite, So, and these poor ladies, you would see them, their arm would swell up, and they'd have to wear these sleeves and everything else. So nowadays and there's lots of folks that do that. One of them is a friend of mine, Marja Massey. She's great, and she sort of pioneered some of this. Is that you take some lymphatic tissue from one place and you plug it into the lymphatics in another place, which 20 years ago was impossible. It was science fiction. And so now they're doing that more and more now. And so many people have had those injuries now can go undergo those surgeries and not have those swellings and not have the sequela of all that.
So have a much better outcome.
Right. Yeah. And so that's really amazing about how far those folks have taken that. And so some of that is technique, some of it it's technology, some of it is how not only during the surgery, but the prep for the surgery, and then also the aftercare of the surgery.
Right.
All of that is really important, and I think that we're getting better and better at that. And by we, I mean not just the surgeons. We're talking about the nurses. We're talking about occupational therapists, physical therapists,
Right, through the whole line.
Lymphatic therapy people, et cetera, all up and down the line. Yeah, it's a team sport. Microsurgery is absolutely a team effort.
Yeah, and also talking about breast surgeries, there's been a lot of innovation. One of the main ones actually was the quality of the implants. Right.
So things have gotten better, and you can pick a topic in plastic surgery, and thankfully most of that's gotten better in 20 years. To your point, breast reconstruction, etc., really has been kind of turned on its head. One, because the implants themselves are better, and by better I mean the leak rate is less, the infection rate is less, things are better as far as that goes. And the folks that do this all the time are really getting some terrific results, and taking away a lot of that, oh my gosh, how am I going to be made whole again, because the reconstructive surgery has gotten so good. And nowadays we're talking more and more about taking both breasts off if you have the
certain
genetic
genes,
right. If you have a genetic predisposition.
What is that? What is that gene?
So it's a BRCA gene. There's a few of them,
right.
and
that are kind of markers for possible.
Right, and especially if you have a family history, etc.
Sure.
So nowadays, they're actually electively taking them both off, or dissecting breast tissue away, should I say, and then going ahead and making reconstruction, and it looks really good.
Right. So it just makes the whole thing less traumatic.
Right. So and then we're talking about nipple sparing mastectomies. We're talking about skin sparing mastectomies, depending on what you have going on, the stage of the tumor, etc. And what's really interesting in that realm, and again, there are folks that do this all the time. I don't, but as I read more and talk to more of the folks about it, I was at a meeting, and the technology's gotten better. What I mean by that is, in the past, when we would go ahead and do a reconstruction, we would go ahead and take tissue from one place and swing it to the other. Or nowadays, they're doing the free tissue transfer, which we already talked about, is taking tissue from one place and plugging it in. But the whole idea was to go ahead and cover the implant with good viable tissue, right? So sometimes with a free tissue transfer, you don't need an implant, which is great. Sometimes if you're going to need a implant, when I was trained is you had to cover it with the pectoralis major muscle, which was your bench press or push-up muscle,
right?
As well as
because that's changed quite a bit too.
Well, here's what changed is so I'm at this meeting, and there's this stuff now called acellular dermal matrix, ADM, which is basically dermis that is off the shelf, and so we
skin.
Right. So it's the strength part of skin. It's the place where you sew to, and it's a place where tattoo ink goes. Okay. So dermis. And we've used it forever. Well, forever, but a long time in the burn units, and so now we're using it on reconstructive cases. So I was at this dinner meeting, and I'm sitting there watching dinner, and they're putting up the slideshow, et cetera, PowerPoint, and this guy's talking about, so we go ahead and the breast surgeon does their thing, and then we put the implant, and then we put this acellular dermal matrix on top of it. We don't even disturb the muscles below, and then we go ahead and put everything together. And I was absolutely gobsmacked.
Right.
If I said that on my boards 20 years ago, that was an automatic fail, come back next year.
Yeah, they'd be like, what are you talking about?
I was blown away. And I'm like, what? We're doing who, what? So I went up to the guy afterwards. I'm like, are you serious? Are you really doing
That's
that?
amazing.
And they're like, yeah, no, we're really doing this. And I was at the lecture, and they have really good numbers. And I came back to Las Vegas, and I asked my colleagues that do that, and he says, yeah, no, we're doing this, and this is really
That's
cool.
amazing. Yeah.
And so, again, to your point is there's always something new, whether it is a new technique, whether it is a new philosophy, whether it is new technical innovation, the ADM. There's always something coming out, which really for me makes it exciting. And I love going to these meetings, and now that COVID hopefully is over and we can have big meetings again, that you can go ahead and see what's going on with the technical aspect of it, because they always have this like marketplace thing where you talk to the reps.
Right.
Also the guys and gals that are up there giving lectures. But my favorite part of that whole thing is lunch. And the reason why I like lunch is not the boxed lunch, which is nice, but basically you're usually at a table with a few guys and gals, and one guy or gal's from Miami, one's from Turkey, one's the oddball.
Because they all have slightly different approaches.
Well, and some guy or gal will say, hey, what did you think of that last lecture? And one guy will say, oh, I think that's great. And one gal says, no, I think that's terrible. And then they'll go ahead and talk about it.
Yeah.
Or one guy says, no, I was his fellow. He doesn't do it that way anymore. So, and that's where you can really
That
learn
interaction.
something. And for me, if I go to a national meeting and if I can take away like 2 pearls, that's pretty awesome. And then I can bring them back and help my patients out a little bit.
And do you think also too, in that same vein, like social media, although it can be good or bad, but that also too, that interplay between doctors, you're seeing what the other doctors are putting out. You kind of look, I mean, not that you accept everything, that's awesome, but has that helped or hindered what you do?
Well, I mean, we can do that for, an hour.
Yeah, and that's a big topic, I should say too. But
about that sort of thing. I think that getting good information out there as widely dispersed is terrific. Okay, I think that, and there are good sources for that, right? So there's the American Society for Plastic Surgery. There is A.S.A.F.S, the American Society for Aesthetic Plastic Surgery. So those I think are the go-to places.
Yeah, those are great resources
for that. And then you have doctors that you can trust, who I look to also. Board certified plastic surgeons. They're certified by the American Board of Plastic Surgery. And then I, depending on the issue, I'll absolutely listen to my otolaryngology friends, the ENT, the facial plastic surgeons, and then my dermatology friends as well. And so, again, it really sort of depends on the topic and what you have going on. And I think that if they really can present something well and give an argument with the reasonable science behind it, yes, that makes absolute perfect. And that you really want to get to the public, because there's so much not great information, or some folks that want to actually sell you something. So it's good to know the resources and where to go to, right? And then, of course, there's edutainment, right? So there's guys that are spinning plates and juggling and, doing all that stuff. And I understand that.
Kind of fighting for space and that.
Right. So and again, it's the world we live in, and it's short attention spans and all that kind of stuff. So, but having said that, is the other thing is then to do your research on sites that make sense. Again, the ASPS site, the ASAP site. Again, shout out to my site. We like to go ahead and put blogs on there, and I like to think we have good information on there. And if you find errors or you find typos, let me know and I'll fix it. But those are, I think, those sort of places where you can go ahead and get good information. And the more good information gets out there to the public, I think it's great, because we try to, at least in our office, we try best we can to take the scary out,
exactly,
right?
Yeah.
And because people are intimidated to go into a doctor's office, right? What brings people to a doctor? Fear. Right? That's a lump. What's wrong? Okay, I can't run up a flight the steps anymore. So it's fear. And so people are not on their best day when they hit the doctor's office. So for me, we try to take the fear out or scary out, in as much as I know that dark rooms are scary because there's no light ons. But if you turn the light on and then there's a desk and a chair, like, oh, well, that's not so bad. So again, knowledge is power, but good knowledge is really powerful, in as much as then you can say, oh, okay, well, here are my options. Here are my goals. Here's where I want to be. How do we get from point A to point B reasonably with some science background? And there's always going to be something new. There's always going to be some new machine or some new product or some new whatever, and then you have to go ahead, and I'm very much a doubting Thomas, you have to go ahead and subject it to the light of reason and the science that hopefully you were taught, and then say, okay, is this good for my patients? Would I use it on my wife?
Patients are always the main
right.
goal.
So would I use it? My litmus test in my office is, would I use this on my wife or my family member? All right. And so, if yes, then algorithm, right? Then, okay, well, then I'll go ahead and pass muster. Now, some folks are early adapters, and that's great. They go ahead and do their thing, and they get nice results and everything else in their practice. Me, I'm kind of a late adapter, in as much as I kind of see, but it's just my personal conservative style, is to see how things go and kind of work out any sort of bugs first before I jump into stuff. But again, that's a style issue more than anything else.
Yeah, and that plays a part. Well, I think, and I've actually been able to join you for some consultations. And what I really like about your consultations is you really take time. Because it seems today everybody is in such a hurry, and obviously some of the practices are so busy, sometimes it's hard for them to do that. So when you're talking to patients, or I would say, like, people that are watching, what are like important questions they should ask the doctor in a consultation, and what should they look for
Sure.
in the consultation to get a feel for the doctor?
Sure. Yeah. So I am not efficient. Yeah, we have consultants come in and they're like, oh my gosh, you know,
they're
say,
like,
so, oh
lots of
yeah,
the
hey
time.
doc, 7 minutes a patient and all that stuff. And my office staff is always rolling their eyes and look, and yeah, all that such, but I can't. That's just, I'm working on it. So having said that, I think a couple things is come prepared for your consultation. What I mean by that is I always like it when somebody brings a friend. Okay, so because they've done the study, and most people will only take away about 30% of what the doctor says.
Yeah, because they get overwhelmed. Right?
Yeah, because I'm throwing a lot of information out at them. And I try to go ahead and not use lots of, technocrat words and all that sort of thing. But it's a lot of information. So that's one. And then so they can go home with their friend. Like, did he say that? What did he mean by that? And also with me is and I tell people during the consultation, like, you're probably going to have a lot of questions. Call and ask, right? So between myself and my staff, one of my staff's been with me 16 years. One of them's longer. So basically, they kind of know.
Most of your staff has been there quite a long time.
Been there a minute, right? So
that's a good sign.
Poor people, yeah. So yeah. But having said that, so if I'm physically in the operating room, whatever, they can answer 99% of the questions. But basically is and then come prepared. Go ahead and make sure you might want to go ahead and write something down, etc. Figure out what your goals are, etc. And then together we can kind of see where we're all going with that. But again, one is are you in the right place? Meaning that if you're coming in for plastic surgery, are you in the office of a board-certified plastic surgeon? Okay, right. So that's step one, because there's few of them out there that are not, but they're doing cosmetic surgery. So
and some of them are pretty famous. We won't name names.
So yeah, and they have, to your point, big social media followings, et cetera, and that's okay. So, but having said that, so if you're in the office of somebody, and again, I've said this in front of the Las Vegas Plastic Surgery Society or national meetings, and says I don't mind losing, whatever that means, a patient to another board certified plastic surgeon, because at least I know that patient is going to get taken care of. Somebody qualified, and they're going to do typically the right thing, and if there's an issue, they're going to take care of it. What gets me is folks that go to somewhere who is not, and then what's going to happen, and again, like it says, is most of the time things go well, et cetera, until they don't. Okay, and everybody gets complications. So do I. I mean, nobody's perfect, not even me.
And the human body does what it does.
My wife reminds me that I'm not perfect a lot. Okay, so we get that. Hi, honey, if you're listening. But having said that, is yeah, and so you're going to get that. So one is you have to go to a guy, in my opinion, got to go to a guy or gal that can handle complications, or better yet, go ahead and recognize complications before they start. Meaning, with me, we're going to go over history and physical, and I'm going to ask you about the medicines you're on. And so if you had a heart attack a month ago, you got to get that straightened out before going to elective surgery, right? If you're on a blood thinner, if you're on fish oil, St. John's wort, there's certain vitamins that'll cause bruising and bleeding. We'll have you off of that. Smoking's another one that we talk about. Vaping, yes, it counts, etc. And so we go over all that stuff to try to put ourselves and get our ducks lined up so that we can get ourselves a good result.
Best case scenarios, everything's working.
Yeah. No, 100%.
Yeah. So what's the big, now being in practice for 20 years, what's some of your biggest takeaways from everything with patients, with the business?
Well, I think that some things still reign true, in as much as, and I talk to kids, right? I talk to folks that want to go into medicine, right? Mm-hmm. So whether they're in college, or whether they're in med school, or whether they're starting out in the residencies or whatever. So some things are still true. I think medicine is still a calling. So if you're going to go into medicine for money, get out now, because it ain't going to be there. And whatever you're going to do, like it, because some point during your career, they're going to call you at 3 a.m. to get up and do it. And it's a lot easier to go ahead and say, all right, well, I'm going to go ahead and help this patient, than if you really are dreading it, okay? Because that's the way that the medicine works. So, and those folks that love it I think are better at it, meaning they're more passionate about it. They read about it more. They talk to their friends about it more, et cetera, et cetera. They're more,
just like any
more in
profession.
it, just like any profession.
Yep.
So again, you do a lot of music. It's the guys that love it. They talk about it. They practice. They enjoy practice. They enjoy jamming for no other apparent reason, et cetera, et cetera. So yeah, so those are the guys that typically get better at that.
Yeah.
So yeah, so those things I think are ring true. I think also, like Dr. Gradinger said, is always be learning, always be reading, always catch up, etc. You owe that for yourself, but you also owe that, in my opinion, for your patient as well. And then also to advocate, and again, this is my advocacy part, is to advocate for the patients, because again, is at the end of the day, I feel that really the physicians are the ones that are really advocating for the folks against the other things that are going on in medicine, and we'd really try to put that on our forefront. I still think medicine is spectacular. I think plastic surgery, I think, is a spectacular branch of medicine, and so for me, it's worked out really well. I love putting my hard hat on and picking up my lunch pail and going to work every day, and so for me, it's great. So, and there will be always new technology, and I've said this before, is that there's no better time in the world to technically be a doctor right now. The stuff that we can do, the stuff we can cure, the surgical stuff we can do is fabulous. It's all the other extraneous stuff that drags people down and gets people crazy and gets to burnout and all that stuff. So in the medical side, we're trying to go ahead and fix that part so that doctors can actually be doctors and actually focus on patients and do what they're supposed to be trained to do.
Yep, patients first. That's always always the goal. Can you tell people how they can get a hold of you? How they can reach us?
So we're everywhere. Sorry. The cornerstone of this is our website, which is www.jjrothmd.com. And so basically there, we like to think that we have a whole bunch of educational material. There's more links to podcasts there. We have all sorts of things there. We have cartoons. We have all sorts of stuff there. Social media world, we are on Instagram and Facebook and TikTok and YouTube and I think MySpace and Friendster and wherever else that might be.
I don't think there is MySpace anymore. I could be wrong.
There might be. So honestly, we're everywhere. And then of course, podcast, what we're doing today. We are everywhere from Apple to Podbean to Spotify to everywhere. So,
iHeartRadio, Amazon Music.
There you go.
Yeah, it's awesome. And it's great to be able to reach everybody and provide hopefully good, useful information. That's kind of our goal. And we enjoy doing this, and we have lots more episodes coming. So
absolutely. And if you have a topic or something that you would like to see or hear about, please let us know, because we've incorporated lots of those in our podcast and video cast. So we love answering questions, and so please ask away.
Absolutely. Have a great day, everybody.